Hi, welcome to Second Earth Alternative. So I'm not really accustomed to doing a lot of episodes regarding diseases, but the issue is I'm having a hard time reporting on anything else just because so much new information is coming. And also there's a lot about this COVID-19 coronavirus that I think in essence is being misstated to the people, that they're getting the wrong information. And part of what we do in this channel is we always try to clear up anytime that the media seems to misreport certain subjects. It's something that we've been doing since the DNC has been cheating Bernie Sanders in 2016. So it's just something that we do in this channel. And because there's so much underlining what's happening with COVID-19, I feel in a way kind of pressed to report on this for you. So today I wanted to start off by showing you where we're at with the disease. So it appears that we have 90,278 cases. But what's kind of concerning me right now is that we have 3,085 deaths. Now, for a while, they've been telling us that the death total is around 2%. Now, mathematically, if you were to divide 90,000 by 3,000, that's closer to like 3.2%. So I don't know why they're telling us that the death total is so low, except for the possibility that maybe they're accounting for cases that have minor symptoms and have not essentially been reported. But something else that we have to consider, and this was something that was brought up by a viewer, is we should not be tallying the number of total confirmed cases versus the number of deaths. I think the closer number would be the number of deaths in relation to the total recovery, which would put this virus closer to 9% mortality rate. So I guess what I'm trying to say is I have these numbers here, but there are two main factors that could be affecting this number. One, the unreported cases with minor symptoms. Two, whether they're taking their fatality rate from the total confirmed cases or whether they're actually taking it from the total recovered cases. Because we don't know what's happening with the people who are currently confirmed. Are they going to die? Are they not going to die? We don't know. But we do know that after a certain amount of months, there were 3,000 deaths and 40,000 people that recovered. So that viewer has a point that this number seems to be a little more relevant. And the question is, are they underreporting the fatality rate of this virus? You look at China right now, they got 500 million people in lockdown. I mean, the type of measures that China is taking, not to mention that a lot of the medical supplies are being supplied from China. So I'm not sure if you heard, but some of the testing kits that they've been using in the United States of America, they're not even working properly. So what I'm trying to infer here is that the amount of cases that we actually have in the United States of America, so they have apparently 100 cases in the US altogether. So according to this article by Time Magazine, coronavirus spreads to more than 65 countries, and here's the latest. Coronavirus is continuing to spread globally with nearly 90,000 cases in more than 65 countries. More than 10% of cases worldwide are now outside of China, showing the disease is spreading further and further afield. WHO Director General Tedros Adhanom Ghebreyesus said at a press conference last Friday, "Wake up, get ready. This virus may be on its way and you need to be ready. You have a duty to your citizens. You have a duty to the world to be ready." For somebody who works as the Director General for the World Health Organization, this sounds, rather alarming, I guess would be one way of saying it. Last Friday, Mexico, Belarus, Lithuania, New Zealand, and Nigeria confirmed the first cases of the virus. Scrolling down further, it says here, Chinese official touted figures that showed there were more new infections outside of China than within for the first time. So this is why I was talking about the nature of China, the fact that they can lock down 500 million people, the fact that they would be willing to weld shut people's homes. This is what they're having to do to slow down the disease from spreading in their country. And yet there are more cases, active cases happening right now outside of China than inside of China. Sri Lanka is not going to be able to handle it like that. Iran is not going to be able to handle it like that. What happens if it jumps in India? 1 billion people, a lot of them crowded, a lot of contaminants there. With, inadequate first world infrastructure, you're talking about massive amounts of people that are all squashed in small areas, often squalor areas that are not very hygiene, at least not in the big poverty-stricken cities. So I guess what I'm trying to say is we have yet to see the full potential of what this virus can turn into, at least not in a global scale. Moving on to the next article. This one is from the UPI. U.S. manufacturing grows near standstill amid coronavirus outbreak. Data from the Institute for Supply Management showed that while technically still expanding, manufacturing growth momentum was nearly at a standstill. Travel restrictions imposed by governments to stem the outbreak were also blamed for the manufacturing downturn, with the respondent from the transportation industry saying, "Layoffs are here."
You're fired.
So, the stock market just took one of the biggest plunges it's taken since 2008. Some people are saying in the history of the stock markets. I still have to look at that to see if that's correct. But the point I'm trying to say is that we have 100 cases in the United States of America. We have cases that are ranging in the tens of thousands in China. It hasn't even reached 100,000 yet. Yet China has already quarantined 500 million people. And so this stock market effect, all the things that we're seeing, all the panic, the shortage of supplies, the bad testing kits, this is happening at the very, very tip of this iceberg. This is happening when we're having 100,000 cases worldwide. Now, this thing has the potential to grow exponentially. So when we talk about going from 100,000 to millions, if not billions of people, mathematically, exponentially, we're just talking about a few days, a matter of weeks, before something that is 100,000 patients becomes in the millions, if not hundreds of millions. How is our infrastructure, how is the world economy going to hold when there are already layoffs happening, when the U.S. has one of the biggest stock downturn it's ever had, and the U.S. case total is not even at 100 yet? We are having problems with testing kits, yet the cases haven't even gone above 100. Do you see why I'm a little bit concerned about the situation? So next article says here, coronavirus in Washington state, 6 dead, 12 other infected. So it appears that, as you probably heard, there was a nursing home that was affected. And, most alarming, and this goes right into the idea that we have bad testing kits. They had evidence that the virus may have been circulating in the state for upwards of 6 weeks undetected, a finding that, if true, could mean hundreds of undiagnosed cases in the area. We have also been notified that some of the firefighters in quarantine are demonstrating flu-like symptoms. So now the people who are actually trying to help, the people who are in the front lines, the police officers and the firefighters, they're not getting the proper protection. See, when China fought this off, those guys came in like you're watching that movie Outbreak, like you're seeing contagion happening right in your eyes. These firefighters are coming with bad testing kits. And now the people who are going to the front lines of the United States are getting flu-like symptoms. We had one of the health ministers of Iran, a parliamentary member who ended up getting sick. So I guess what's concerning me is the lack of preparation that the United States is having. I don't know how to stop this. I don't think anybody knows what to do at this point. China certainly had their means, their way of taking care of it, and they seemed, pretty proud, as they, says Chinese officials touted. Doesn't that mean to brag a little bit, that their figures were down compared to other countries? And something else that also is starting to kind of concern me about how the United States is going to be able to handle this virus compared to a communist dictatorship type regime that can essentially do what it needs to do against its citizens. It's great living in a freedom-loving country, but one of the things that you have to take with that is that you're not going to get everything perfectly efficient. That in a country that prizes freedom, you also have to protect certain liberties. And in the process of protecting certain liberties, you might have a harder time dealing with an emergency scenario like an outbreak than a communist country like China does. And, check this out. COVID-19 quarantine leads to surprise medical bills for U.S. family. You got to admit, folks, universal health care doesn't sound too crazy now, does it? Says actor comedian Larry Davis in a character as U.S. presidential candidate Bernie Sanders. Now, as much as that might have been played off as a joke in Saturday Night Live, there is a lot of truth to this because, as we can see, the hospital bills apparently got there first. So far, the bills total $3,918 for a family, a father and a daughter. They were quarantined for a few days and ended up being negative for the disease. So just for having themselves checked out, just for being responsible and making sure that they don't have the virus, they're now tagged with a $2,600 ambulance bill, as well as charges for the radiologist. We have a country where most of the people are paycheck to paycheck, okay? We have, I think, like 60% of the people who won't be able to afford like a $500 bill. And now just to visit a doctor and to make sure everything is okay, you're going to have to be responsible for $4,000. Yeah, fuck off. It's just not going to happen. Something's going to break down in the system. Either the people will break it down or the system is going to break down. I guarantee you, you're not going to have hundreds of millions of people in the United States all putting down $4,000 to visit a doctor. It's not going to happen like that. And I understand in capitalistic countries, there is this bad tendency to take advantage of things that are basic necessities for people. That's why real estate, everybody needs housing. Everybody needs shelter. So I guess it makes sense to make real estate almost insurmountable for most people, at least in California, so much so that 60% of Californians are leaving the state just because of how pricey it is. Or maybe the pharmaceuticals, like the cancer treatments. In the capitalistic system, you have those cancer treatments. They're the ones that are most expensive. Things like the internet bill. Everybody needs internet now. Most people need a cell phone. So let's jack up those prices. Same thing was happening to cable bills. People needed television. They needed to be in touch with news stations, with what was happening in the world. So before the internet came around, cable bills were off the fucking hook. And then there's dentistry. I know individuals who have gone to Canada, who have gone to, I know somebody who went to Russia to get their dental work. Because nobody's willing to pay $2,000 for fucking teeth when they already have to pay $4,000 to have an ambulance to make sure that you don't have coronavirus. Okay? This is not sustainable. I don't understand that laissez-faire is a necessary component to allowing certain industries to be run. But the difference between the United States and Denmark is that Denmark can make a lot of the industries super laissez-faire. They are capitalistic, very cutthroat to a certain extent. But when it comes to certain basic human dignities, they don't put a goddamn price to it. They don't say a $4,000 bill for a freaking ambulance. They don't tell you that you have to go to a different country to get a single teeth done. So I don't know how the hell the United States of America, given the way that this system has been set up to help these big companies take advantage of the small people and the things that we quote unquote need the most, I don't know how this system is going to deal with hundreds of millions of people needing to be checked for coronavirus. Not to mention that, according to this article, reports that a woman in Japan have tested positive for the COVID-19 disease for a second time after seemingly recovering will alarm scientists and public health experts trying to control the spreading epidemic and underlining how much we still do not know. So, according to this article, it's one of two things. Either the quarantine period is way beyond 14 days, or this disease has the capability of relapsing almost in a two-stage manner, as if the disease itself is categorically a two-stage disease. The stock market has gone down higher than ever with only 100 cases in the United States. The United States is a lot less capable of being able to deal with this than China because of the liberties that we're protecting. We don't have the test kits that China has. We don't have some of the ingredients for the medicines. So if this article is telling us that manufacturing is coming to a standstill and there's only 100 people infected, what do you think is going to happen when there's 100 million people infected? Sports, there's going to be no sports. You can't put crowds of people in a stadium. Schools are being completely closed down all over Asia, including Japan, which highly prizes their education. This is a situation that we just got into. It's going to get worse. So I've been telling people, look, if you can get your hands on some gold, this is the time. People might think, oh, it's too late. Everybody, no. People were underestimating this virus only 3 days ago before the stock market went down. Otherwise, a lot more people would have shorted the stock market. My assessment, and I'm not an expert, I'm not giving financial advice, so to speak. I'm just simply giving cautionary advice that perhaps it might be a good idea to put or diversify some of your assets into things that are more physical, tangible, silver, gold, things that won't go down value because, let's say, monetary system suddenly is unable to print money anymore. Once again, I'm not an expert on this, but I don't know how the world is going to recover from this, with every single industry essentially going down for possibly months and months, maybe years, given the rate of infection, given how little we know about the disease, given the possibility that the disease could mutate and possibly mutate for the worse. And even if the summer months were to burn off this disease, you have to consider that the Spanish flu, when the Spanish flu was burned off in the summer and then relapsed in fall, it relapsed in a lot worse way. So we could have an endemic disease. And at this point, what I'm thinking, the best advice to give people, you can stock up, you can get some beans, you can get some water. The only thing is that I was just talking to one of the viewers from my channel. She has friends in Shanghai, and they got like the top gear from the medical industry before some of these masks became not allowed to be sold to the citizens because they needed it for the hospitals. So they got the top medical gear masks, and they were getting delivery services for food and was, spraying 75% alcohol solution to wipe out the food. And the way that the viewer was describing is they were, very, very responsible individuals who really prepped well for this case. As of yesterday, they now have the virus. So what I'm trying to say is, I don't know if you're going to be able to run away from this. It could be that most of the world is going to get infected by this thing. And so at this point, my best advice is get some sleep. It sounds strange. It might be difficult after an episode like this, but it is important that your immune system is as strong as it possibly can be, because, our immune system is the best weapon that we have against this thing. In the end, if this thing mutates for the worse, our immune systems are the ones that are going to have to react in time to create a fighting chance against the disease. It's the human biology in aggregate that will be the biggest force against this disease in all probability. And if you don't get enough sleep, your immune system is going to be compromised. So there are different things that you can do to essentially just prep your body. I used to smoke cigarettes. I quit. I said, fuck it. I'm not smoking cigarettes. Not with this disease, not with a disease that has to do with lung infection. So just make proactive choices that will help you sustain it in case you get it. Because at this point, what are people going to be hiding their entire lives from this? From something that is, I don't know how you wipe something like this off the face of the earth unless it wipes itself off. It looks like the death toll could be a little bit higher than 2%. We don't know for certain. If you do have a very strong immune system, you will likely survive. We still don't know a lot about this disease. It seems like it's a very shitty, crappy situation. But, humans have gone through worse in our history. Things like this, it's not irregular to have in human history. You're talking about black plagues, you're talking about volcanic eruptions, you're talking about major earthquakes, tsunamis, wars, these things happen. So this is just, it's going to be a setback, but in all, humans will get through this. So just do your best to stay safe and keep your body healthy. And, like I said, hopefully this thing will start mutating for the better. So for the friends of the viewer who ended up just getting coronavirus, I just want to, give my prayers to you and wishes. And hopefully the rest of the audience can join in with a positive intention of healing. Right now it's about healing. not just for ourselves, but for the human soul, for global culture. This is going to get worse, not just with the disease, but also with the economic markets. So there's going to be a lot of healing that's going to be done after this. So I have like 3 episodes that are coming up. Like I said, it's just because there's so much going on with this coronavirus that I had to make this episode. But I'll try to sneak those in between if people want to listen to other things and get their minds off of all this hysteria. So anyways, thank you for sticking with me. This is Felipe Osorio, signing out.